Hey, hope you're doing well out there. Had a couple questions about footwear, especially with the weather changing and going into maybe flip-flops, and just sore heels or sore bottoms of your feet. I want to give you some ideas, some tips you can use right now at home to help yourself and your body work better. Some things I want you to consider, grabbing a simple soft tissue ball. Also consider the health of your spine and nervous system. It goes all the way down the chain from the foot to the knee to the hip, connects to pelvis, the spine, and all the nerves travel back up to here. So consider this movement and proper structure and function is going to be important in terms of optimizing function and how you move and optimizing your healing potential. So consider this. And when you're considering the soft tissue ball, and some simple things you can do to help build some compliance, especially in the bottom of that foot or through here, so that you don't get to the point where you necessarily, get foot pain, right? You want to be proactive. Some of the things that I would consider is, if you're doing a lot of walking, avoid wearing the flip flops. Maybe wandering around the house, but if you're going on walks and whatnot, avoid that extra. It changes the way your foot contracts and tries to hold onto the shoe. So it actually changes the way your foot moves. And if you think, if you're doing, lots of walking in the summer and doing that 8,000, 10,000 times in a day, let's say, it may get to the point where you've changed your footwear, do that 8,000 times a day, you may get some breakdown and you may get some discomfort or pain. So here's what I want you to try. Change your footwear, right? Or, wear some sort of nice minimal barefoot shoe. Right? I like doing that. And also grab the lacrosse ball out. So start with, you can start with some basic bottom of your foot and some basic soft tissue massage. And when you're in there, you're probably going to notice, let's bring you down a little bit so you can see a bit better. You're probably going to notice that you're a bit stiff and sore in some areas. So when you're here, when you find a tender spot, breathe into it, hang out, gets a little easier, move on to the next one, and go back and forth, right? Because you got a lot of soft tissue in there. And just, you can go toes up, toes down, really bring them to the end range, toes up, I really notice it. Go back and forth, breathe. Now try that. The other thing I like is, just basically sitting on your knees, right? Sitting like this, but I'll do both. So this one I found really works well for patients in the past is hanging out like this. Notice my toes are going up towards my knee. I may sit, 30 seconds to a minute. So you get a bit of a stretch, helping to build some compliance in there so things get to the end range and go through a range of motion. And then also just like this, toes down. So toes down going this way. And you're thinking as well that, everything wrapping around here like a big sling, things get tight through here, the back, the front. So you're working on loosening them up, focusing on your breathing. And this is great, sit 30 seconds to 1 minute this way, 30 seconds to 1 minute this way, and breathe into it. This is something you can do easily for yourself at night. You'll notice this simple cloth here as well. And what you can do is help condition. First of all, try that. I love that one. The other one is get this simple cloth out and literally you can try to, when you're down here on the ground, try to pick it up. So I scrunch my toes around it. It's good on a wood surface or a tile, but I'll scrunch my toes and try to, see at the bottom of the camera there, bunch it up. So I get used to, pumping blood in, groceries in, garbage out, thinking, and focusing on moving that foot and contracting those small muscles and conditioning them. So you're literally always think movement is a good thing, right? Oftentimes, we start to get wear and tear. We're probably not moving enough. Your joint needs to go through a range of motion, preferably every day against resistance for you to optimize your joint health. Think about that for a minute. How often do you go through a full range of motion and against resistance, right? So otherwise, the joint starts to break down. So keep yourself, your feet healthy. Consider the lacrosse ball. I think this is a great one here. Consider your footwear. Try to avoid the flip-flops where you got to contract down to keep them on, which is going to change the way you gait and change the way you move. Also consider, barefoot shoe. I like the barefoot shoes. And something, or I always like to consider, the family chiropractor, is, all the way up from here, your calf to your knee, to your hip to your pelvis, to your nervous system, your lumbar spine. Everything has to work well through here. Some of the areas you're going to feel, some areas you're going to have no idea about, and that's exactly why we check your spine and nervous system to make sure you're working at your best. So consider all the way up the chain in the whole body to optimize your health and enjoy your summer that much more. I'd love to hear how you make out. And I'd love to hear if you start these simple exercises, put a comment below, or if you're going to try them, make commitment to doing them regularly and be consistent with it and be consistent with the mobility, and you notice a difference. The likelihood of noticing a difference is much higher. Anyways, I will talk to you soon, and I hope you're out there getting some steps in. Bye for now.